Hello everyone, welcome back to Comment Made Easy, and I hope you all are doing very well. Before we begin, let me remind my dear students that the contents of this channel are only to supplement your knowledge, not to replace the regular online and offline classes in your institution. So please attend your classes and do not miss them. Also, if you like our contents, please subscribe to our YouTube channel, like the videos and share these videos with your friends, with your batchmates, with your juniors. Also, if you are a teacher, then with your students. Please follow our Facebook page and the link will be given in the description. Today we shall discuss two different topics: post-conceptional method, also known as the termination of pregnancy, and permanent method of contraception. First, the post-conceptional methods, which include the menstrual regulation, menstrual induction, and oral abortifacient. Menstrual regulation, where we aspirate the uterine content usually 6 to 14 days after a missed period, because this is when the couple suspects there may be a pregnancy. But it has to be done before most pregnancy tests can accurately determine whether or not a woman is pregnant. Because if there is any test available which can accurately confirm the pregnancy, then there is no point of doing the menstrual regulation process blindly. Sometimes cervical dilatation has to be done for aspiration, and it is usually done in case of nullipera or in subjects who are very much apprehensive. There may be certain complications. The immediate complications include uterine perforation and trauma, and late complications, which occurs usually after 6 weeks, include tendency to abortion or premature labor in future, infertility, menstrual disorders, and increased chance of ectopic pregnancies, and Rh immunization. Next method is menstrual induction, which is based on the concept of disturbing the hormonal, that is progesterone prostaglandin balance. This is done by intrauterine application of 1 to 5 mg solution, or alternatively 2.5 to 5 mg pellet of prostaglandin F2. Within a few minutes of prostaglandin application, because of the action of the prostaglandin, there is sustained contraction of the uterus lasting for about 7 minutes, and this is followed by cyclic contraction of the uterus continuing for next 3 to 4 hours. This whole process has to be done under sedation. The bleeding starts and continues for 7 to 8 days. Next is the oral abortifacient, which is the most commonly advised method and most commonly, or better to say, most scientifically approved method of medical termination. So the drug which are used for this purpose is mifepristone, also known as RU486, along with misoprostol. And when these two drugs are given in combination, it is 95% successful up to 9 weeks of gestation with any complication. Commonly used regimen is mifepristone 200 mg orally on day 1, so that is the single dose, followed by misoprostol 800 microgram vaginally either immediately or within 6 to 8 weeks. So two drugs are given: mifepristone 200 mg, which is given orally, single tablet, and misoprostol 800 microgram given vaginally. This is the kit. There are multiple kits, different kits from different brands available. In this diagram you can see this is a single tablet of mifepristone 200 mg, and these 4 are the misoprostol tablets, 200 microgram each, so 4 tablets is 800 microgram. Mifepristone is to be taken, and misoprostol is either given vaginally within 6 to 8 hours, or better to give immediately when the mifepristone is taken. This is the regimen. There are certain contraindications when this method should not be used. For example, any history of allergy or unknown hypersensitivity to mifepristone, misoprostol, or other prostaglandin, confirmed or suspected ectopic pregnancy or undiagnosed adnexal mass, intrauterine device in place, chronic adrenal failure, hemorrhagic disorder or concurrent anticoagulant therapy, inherited porphyria, and if the patient does not have adequate access to medical facilities equipped to provide emergency treatment of incomplete abortion and blood transfusion. So in all these situations, this medical method of termination should not be used. Next is the termination method, which is basically the permanent method. Sterilization is the only method that gives permanent protection from conception. So either the husband or the wife can undergo sterilization by simple surgical procedure. That is vasectomy for the male person or the tubectomy for the female person. Either husband or the wife has to undergo this method. Both of them do not need to go for the options. This is a diagrammatic presentation of how these things are done. This is the testis where the sperm is produced and stored in the epididymis. Then it reaches the urethra via the vas deferens. So what is done is, first the vas deferens, this is ligated and then it is cut. So the channel is interrupted. So the stored sperm cannot reach the urethra. And in case of tubectomy, the fallopian tube is first ligated, or we can say banded, and then tied and cut and cauterized to occlude the lumen. So these are the process of vasectomy and tubectomy. There are certain guidelines for sterilization. So certain criteria must be fulfilled. For example, the age of the husband should not ordinarily be less than 25 years and should not be over 50 years. So ideally it should be in between 25 to 50 years. Same for the wife, and the age is either more than 20 years or less than 45 years. So in between 20 and 45 years. The motivated couple undergoing the sterilization process must have 2 living children at the time of operation. If the couple has 3 or more living children, in that case the lower limit of age of the husband or wife may be relaxed at the discretion of the operating surgeon. So the surgeon can decide whether this cutoff age, 25 years for male or the 20 years for female, that is the lowest allowable age, can be relaxed provided the couple already has 3 or more living children. And it is sufficient if the acceptor declares having obtained the consent of his or her spouse to undergo sterilization operation without outside pressure, inducement or coercion, and that he or she knows that for all practical purpose the operation is irreversible, and also that the spouse has not been sterilized earlier. So not only the person undergoing the operation should give consent, his or her partner should also give consent, and this consent should be taken without any pressure or coercion. That means they must not be forced. Also, it must be told to them and explained to them that this is a permanent method or irreversible method. Only after receiving such consent this process can be followed. Vasectomy is basically male sterilization, and it is a comparatively simple operation that can be performed even in primary health centers by trained doctors under local anesthesia. And there may be certain complications, like operative complications include pain, scrotal hematoma, local infection. Sperm granules can be there, leading to pain and swelling, and also sperm granules are the cause behind spontaneous recanalization, which occurs in about 0 to 6% of the male people undergoing the surgery. Autoimmune response can occur where antibody is produced against sperm, but it usually does not cause any problem. And psychological complications can occur because the male partner can develop certain psychological problems, including reduced sexual vigor, impotence, there may be headache or fatigue. Certain post-operative advices following vasectomy: the patient should be told that he is not sterile immediately, and at least 30 ejaculations may be necessary before the seminal examination is negative. So till 30 ejaculations there may be presence of sperm in the seminal examination, and during this period they should use contraceptive until the aspermia is established. That means there is no sperm. Following the operation, for the next 24 hours the person should avoid taking bath, and they should wear a tea bandage or scrotal support for 15 days and to keep the site clean and dry. Any kind of heavy activity like heavy weightlifting or cycling or lifting heavy weights should be avoided for the next 15 days, but there is no need of complete bed rest, and the stitches are to be removed on 5th day of operation. So the person must visit the hospital where the operation was done. Female sterilization should be undertaken only in those centers where specialist gynae-obs are available as well as anesthetist is required. Patient selection, it is not an advisable procedure for postpartum patients for 6 weeks following delivery. However, it can be done as a concurrent procedure of MTP. If the hemoglobin is less than 8 gram percent, it should not be done. And if there is any other associated medical disorders like heart disease, respiratory disease, diabetes, hypertension, then also this female sterilization method should be avoided. Certain choices are now more popular. For example, for men, compared to the conventional vasectomy, the NSV, that is no scalpel vasectomy, is more popular. Here, rather than cutting the skin, only a puncture wound is done for the operation. So that is why it is even more easier to do. There is even less complication. And for women, mini lap operation is done, which is also known as the Pomeroy technique, compared to the conventional laparoscopic ligation method or tubectomy method. So with this, we conclude today's session. If you like the video, please subscribe to our channel and share this video with your batchmates, juniors and friends. We also have a Facebook page that you can follow. The link is given in the description. Take care and we shall see you in our next video.